This is just for note taking, or if you miss a meeting, we do send this out to our Google group, so that if you miss a meeting, you can always watch the recording, or you can go back and watch the recording if you need to take some notes. So we'll go ahead and get started. Just some Zoom features, and I know you've all been Zooming for the past 3 years pretty consistently, but just in case, we have the chat function available. If you would like to use that, you can, if you have any questions or comments or anything during the discussions that you don't feel like coming off mute for, you're more than welcome to add it to the chat. You're also able to direct message people on the chat if you have a specific comment or question. We do have live transcript available. I believe it's actually called captions now. Zoom's always updating, and you can find that on your menu bar if you would like to have live captions available. And then if you would like to contribute to the discussion, and come off mute, you can raise your hand by using the reactions button and raising your hand. Like I said, we are recording for purposes. If you'd like to go back and look at the recording, you're more than welcome to. We'll send that out and follow up. And we do have that live transcript available. I'll go ahead and pass this over to Mike.
Thank you, Laura. Good afternoon, everyone. Welcome again to our Patient Family Partnership Hub conversation. Again, thank you so much for taking time from your day and joining us. Please know that we appreciate and value your time tremendously, and that you are helping shape healthcare services for all our LA County community. Again, welcome everyone. Bienvenidos a todos. In a minute, we'll do introductions. I just want to do a quick check-in to see if someone is joining us from Green Translation this afternoon. Is anyone joining us from Green Translation today?
Yo, Maria Montes.
Oh, awesome. Thank you, Maria. Thank you for joining us this afternoon. Maria will be helping us today by simultaneous translating our conversation in Spanish, and vice versa. We'll be helping our Spanish-speaking patient family advisors join in our conversation. Today, we aim to have a conversation focused on how we can improve upon the messages that we send out to our community. My name is Miguel Renteria. I go by Mike, and I'm an improvement advisor for DHS. My work evolves on patient experience and supporting our culture of patient-family engagement throughout our health system. The slide here is showing our mission. Our mission is to advance the health of our patients and our communities by providing extraordinary care. Our goals range from transforming our system to provide cost-effective care of the whole patient across the continuum, optimize clinical quality and patient experience, to have a high-performing workforce, and ensure financial viability in supporting our vision. Today, we're moving towards our mission by advancing on our strategic goal of providing high-quality care and patient experience through engaging your voice to help us in our work. Your voice, your views, and insights are incredibly important to our work, so thank you again for taking time off your day and joining us here this afternoon. Next slide, please.
Thank you. All right, thank you.
Laura, I will pass it back over to you.
Thank you. And while you were talking there, I did set up the interpretation. So if you would like to have Spanish interpretation, on your menu bar at the bottom there, it looks like a little globe, and you can click which language you would like to hear the meeting in. All right, I'm Laura Jackson. I'm the Director of Community at PFCC Partners, and we partner with the LA County Department of Health Services to put on, facilitate this patient-family partnership hub. Our mission at PFCC Partners is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. Our vision is a health system transformed, one that works with people and through communities as a partner in their well-being. Our values at PFCC Partners include equity, inclusion, diversity, collaboration, and being solution focused. And I will pass it over to Lindsay for this slide.
Hi, everybody. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. And I just wanted to quickly talk about the partnership hub here at DHS and how it relates to the patient family advisory councils also at DHS. So there are 11 patient family advisory councils all across DHS health centers and hospitals, and they work really locally to support the health centers and hospitals to improve their programs, policies, and processes, all based on the lived experiences of patients and family caregivers who serve as patient family advisors at their local DHS advisory councils. And so the partnership hub really encompasses and supports those patient family advisory councils, but also opens up the door for anyone who would like to share their experiences, their perspectives on more DHS-wide programs and projects, just like what we're talking about here today. It's a community of patients and families all using their lived experiences to influence healthcare, whether locally at those advisory councils or when you can jump in and share your ideas, share your thoughts and perspectives that will really help to influence changes to ensure, just like Miguel said, that DHS is providing the high quality care that all of us patients want to receive. So as being part of the partnership hub, you can join. We have just an email list that you can join and get updates on these meetings, on other opportunities to participate in listening sessions and focus groups, completing interviews, everything like that. And then there's also an online forum that I know Laura will be talking about later. Of course, these monthly meetings that we host to build community and just talk about what's going on at DHS. And finally, we will be sharing a ton of educational opportunities all throughout this year, so you can continue to grow as a partner in healthcare. So more information to come today and throughout the year, but just wanted to touch on that really quickly. And if you are interested in getting involved more locally in an advisory council, you can let us know and we can connect you with one that is close to you.
Thank you, Lindsay. All right. So this is our agenda for today. We did our welcome, we'll do some introductions, and then we'll have our discussion today on knowing your partner, knowing your status. We have Veronica in today from the communications department, and we're going to talk about messaging. And then we have a couple of those engagement opportunities that Lindsay was talking about, one being a patient community open house that we are holding in May in LA. So that is the meeting today. We'll start with some introductions. Let us know your name, what you're calling, where you're calling in from, and what you're looking forward to in the new year. I can get started. I'm Laura Jackson. Like I said, I'm the Director of Community at PFCC Partners. And I am calling in. I live in Eugene, Oregon, and I am looking forward to doing some traveling in the new year. We've got some fun things planned. I'll go ahead and pass it over to Shantae.
Good afternoon, everybody. My name is Shantae Hawkins, and I'm calling in from San Bernardino, California, which is metro to Los Angeles. What I'm looking forward to in the new year is more possibilities to collaborate on new opportunities and just grow personally and professionally. And my son's survivorship in March.
Yay! That's exciting. Well, thank you. Thanks for joining us.
You're welcome.
And let's have Kel and Jose, or Kelly.
Hi, I'm Kelly. That's Jose.
Hi.
We're calling in from LA. I don't know, getting our kids home and being able to advocate better for ourselves and them
Nice.
and finding that right resources, because a lot of it seems like all zoned,
Yeah,
and there's been so many zonal issues.
yeah. Well, thank you. Thanks for joining us today. Thank you. Lindsay.
Hi again. I'm Lindsay. I'm calling in from Sacramento, California, up north, but our office is in Long Beach, California. So that's why we're so excited to be able to connect with all of you in the Los Angeles area, because that really is our home base. But I'm up here north in Sacramento, and I am looking forward to my husband and I love to go to concerts and see live music, and we have a great lineup of concerts even over the next 2 weeks. So I'm just looking forward to more live music.
Nice. That's fun. Thank you. And Mike.
Hi, good afternoon, everyone. My name is Michael Renteria. I'm calling from Northridge here in California. What am I looking forward to in the new year? I am looking forward to learning how to be a better cook, I think. I picked up cooking the last year or so, so I'm focused on not cutting myself while I'm chopping things and just learning new recipes. So yeah, thank you.
Nice. Thank you, Mike. And then Veronica.
Mike, are you missing fingers?
I know, it's a good question.
Not yet. Not yet.
Well, we all say always use a fork when cutting if you're not sure if you're going to cut your fingers off.
Yeah. So thank you for that. That's a great tip. Thank you.
Love it. Love a good tip. Thank you. Thanks, Mike. And Veronica.
Hi, everyone. I'm Veronica. So I'm here representing patient engagement team, and I manage a couple of programs within that team. I manage the Health Tech Navigator program and now the call center staff that we have. Let's see. And I'm calling in from Los Angeles. Our offices are in Alhambra. And what am I looking forward to this year? So I think taking my MCAT finally. I'm looking forward to getting that over with. So yeah, that's something I'm looking forward to this year.
Nice. Well, congratulations ahead of time.
Thank you.
All right. And then we'll go ahead and keep it with Veronica. We're going to talk about the World AIDS Day and chlamydia screening messages. And Veronica, I'll let you go ahead and take it away.
Okay, sounds good. So yeah, so the slides that we're looking at right now, so these are these are text messages that are sent out to all of our DHS patients who are opted in for to receive these text messages. So the ones that we've sent recently are World AIDS Day, and then chlamydia screening. So here you can see both of our English and Spanish scripts for both topics, and they're pretty similar in the context that they're sent. So it just kind of tells you where it's being sent from, and it gives a little bit of background, but it also keeps it short and minimal just so it's not overwhelming to the patient. So aside from that, if we go on to the next slide. Within the same campaign. So we also send emails for the chlamydia campaign. We don't send emails for the other one. And that's something that we might look into in the future, in the near future, but currently the way that it's set up is for the chlamydia campaign, we do send out both text messages and emails. And this is kind of like what the email, this is what the email looks like. And it's usually in like one long like panel. It's just broken down here because it didn't fit, but normally when patients scroll down, they just see this. So we've got the image there. So it just to, you know, give a little bit of context. And then afterwards it's just, it just says, you know, you probably received a text about lab work needing to get done. and then it gives a little bit of information as to what is recommended. So for this one in particular, what's recommended is that women 16 to 24 years old get checked each year for chlamydia. So it gives a little bit of context in that sense. And then it also gives additional information. So it gives additional information in, so even though chlamydia may not have any clear symptoms, it can lead to serious health problems. So it's just kind of, I guess, like what it highlights is the importance of early detection and all of that. So aside from that, just so that we don't overwhelm the patient with a lot of information, what we add is a link as to where patients can go to read a little bit more about this topic. And then it shows the LA Health portal, and then also does a little bit of information as to how to enroll into the portal. So this email is also sent in Spanish, I believe, if you go to the next slide. Yeah, so it's also sent in Spanish. So it's based off of whatever option the patient has within their electronic health record. So if they have their primary language as Spanish, then this one would be sent out. So yeah, so I guess like moving on to like the questions, we just want to see, you know, looking at these text messages, how do, you know, patients feel about receiving these text messages, and, you know, what do you like about the outreach? What feedback do you have? Like, what are your concerns? So I definitely want to open the floor and see anything that you all had to say.
Thank you, Veronica.
Of course.
Does anybody have any feedback on the messages?
I have a question.
Go for it.
Are portals linked together?
What do you, oh, you're muted. I'm sorry, you're muted. I don't think we heard the second part of that.
Sorry, scam likely called me.
Oh
Yeah, horrible person.
no.
No, I was asking if all the portals are linked together, like if mom has a child, are they linked into the same portal where mom's able to check that, or like dad's able to check?
That's a great question. So we do have a proxy option right now where parents can proxy their children's account up to age 12. We are working towards doing age expansion. So currently in California, there's a law that prevents parents from having, you know, their child's full patient information beyond the age of 12, but we're working towards getting that fixed, or towards finding a way to have our patients have access to these records, because currently patients who are 13 to 17 cannot enroll into the portal, right? So we're looking for a way to have those patients enroll. But to your question, let's say you're calling and you know you want to enroll your child and you already have a portal, you can definitely add your child as long as they are within the 0 to 12 age range. And then within that one portal, you will not only be able to see your information, but also your child. So it's easy to toggle back and forth for.
I know for myself right now, we have a portal with Next MD. I don't know if you guys know what that is. Either way, I'm not able to access my daughter's charts.
Oh.
And she's not even old enough to have a say. She's only almost 3 and I can't even access her medical charts or any of that. So that's something that's extremely important when bringing up other portals, because it seemingly seems to be a long span of issues when you go into a portal through like an adult portal in the household into like their children's.
Yeah, no, I hear you. So what I've learned throughout this process of the age expansion, so the 13th through 17th, is that not all health groups have the same structure. So even though DHS, our portal does allow the 0 to 12 age range to be proxied by parents, others may have other rules. And I didn't realize that until we were trying to develop this new workflow, because the Children's Hospital actually does allow parents to have access to their kids' records at all ages. They don't have that 12 to 17
Yeah.
restriction. So that's where we're kind of looking into to see what we can learn and what we can bring to DHS to make sure that those parents have access to child's medical records as well. But that's great feedback. Thank you.
You're welcome.
Anything else?
I have a question.
Of course.
Um, the campaign, is it based off of like just a random update that people are getting because they're subscribed to some form of communication, or is this information targeted to specific patients?
So as long as they're opted in to receive these text messages and they fall within sometimes it can be targeted, right? So if we filter it within specific age groups, then only that specific age group will receive it. So in general, so like, let's say we're sending out a flu campaign for the flu shot. We normally send that to everyone who's 18 or older, just because if we send those text messages to any medical records that are connected with children, it could send it to multiple places. Sometimes they have both parents, logged in as authorized representatives, so it might send that to multiple places. But it really depends, right? So it depends what our target audience is. So if we are looking to increase, let's say, flu vaccination within children, we might word it a little bit differently and send it to that target audience, but it's never meshed because it needs to be specific wording as well. But that's a great question.
Thank you. So for someone who's going to receive this information on chlamydia, will they have, like, do people have choices to opt out of certain campaigns or qualify for certain campaigns?
Yeah, I from my understanding, so as long as they opt in to receive all text messages will come through. If they opt out, then they will completely opt out. And then they will have to submit their approval to have those text messages sent out to them. But it can be done. The process has become a little more simplified, whereas all a patient needs to do is send a text message to a particular number. And then once they send that text message, they're automatically back in. If they want to unenroll, it's the same thing. So they'll just, you know how sometimes you get those text messages and they're like, oh, stop receiving. So it's also in the same way. So it's really easy to pause it and then restart it. But as far as specifically selecting what campaigns you can receive and whatnot, I don't think that there's something to filter out of right at the moment.
Okay, because I was just wondering, like, when we think about privacy,
Yeah.
And sometimes sometimes things, as much as we try to control who is who is having access to our information, sometimes it's not that easy. And so therefore we could probably encounter, like, for example, if I had this particular campaign come across my phone, maybe my husband will be like, wait a minute, might send a signal or something. And I'm just wondering, like, or maybe somebody might feel like, oh, this doesn't pertain to me. I don't want to get information about chlamydia. I'm not even, maybe, I'm not sexually active, or, I don't encounter these things. So I was just wondering if there was an ability for people to kind of select what kind of information they wanted to receive versus just because they signed up, they would get everything,
Yeah, no, that makes total sense. And I think that that's a great point to bring up. So I'm gonna definitely take this feedback because I do think that having the option of giving the patients the option to opt out of certain campaigns is definitely something that we can work on in the future and just develop just for privacy and all of that. So our goal is definitely continuous improvement. So the more feedback we get, the better.
All right.
Yeah.
You're welcome.
Anything else? Okay.
I actually had a question, Veronica. How often, for this campaign in particular, how often are you planning to do that outreach?
Yeah, so it really depends. So for flu season, we only do it once a year, right? So we'll do it during the flu season area. So what I've seen lately is campaigns typically are done once a year. So things are scheduled on a monthly basis. So this month may be chlamydia, next month may be something else. So I've never seen the same campaign happen the same year. So it's on a yearly basis.
Got it.
Yeah, great question. Thank you. All right.
If any other comments or questions or feedback on the messages?
All right. If there aren't any, what I'm gonna do is I'm going to drop my my email on the chat. If you think of anything, please feel free to reach out. And yeah, and then we can chat and see how we can continue to improve in this area.
Great, thank you.
Thank you.
Yeah, thanks, Veronica. I was looking again at the text messages, and maybe that's something we can send out for additional feedback so people can kind of sit with it and look. But I appreciate how simplified they are, but still get you the information that you need.
Thank you. Thanks so much.
Yeah. And we can also send out, like Lindsay said, send out all the messages we saw today. They are also in the new community forum we have. And actually, I'm going to bring it up so we can see what it looks like. Excuse my computer's a little slow right now. So this is, let me make sure I'm at the right page here. This is our community forum, our online forum. It is new, a new home for our forums. We originally had it with our PFA network forums, but the LA County Department of Health Services Patient Family Partnership Hub got its own place for the forum. So I'll send this link. I can add it to the chat here. And you're more than welcome to go there and sign up. But to see the posts, you just click this square here. And then we have some conversations already started here. And then here's that feedback on those messages there. So you are more than welcome to head in there and read some of the messages. I believe those are the text messages that Veronica was talking about. And if you have additional feedback, you're more than welcome to add it there.
And Laura, sorry, just to stop you. It looks like our interpretation isn't working. I don't know if you can. Says that the globe doesn't appear.
Give me one moment, folks. Sorry. Thank you, Lindsay.
Yeah.
I have it in there.
Yeah, I can see it, but
You have to go down to the toolbar and hit more,
Mm-hmm.
and then from there it'll give you the options of meeting settings, interpretation, and disconnect audio.
Are you able to go in and check your language or click your language?
Yeah,
Interpretation.
because it gives you the option to do either English or Spanish.
Okay.
yeah, I can see it too, but it doesn't look like it's working. We can try to work on that on the back end, but
I
go
can
ahead,
try to
Laura.
see if it'll go to Spanish for me.
Yeah, sorry.
I might not understand you for a second, but say something.
Something.
Hello.
Hello.
Laura, do we know if Maria Montes was able
Yeah.
or assigned the interpreter?
It's not
panel?
coming through in Spanish.
Yeah, and Miguel, I don't think Maria is our interpreter.
Yeah, okay.
She
Is
said
anyone
it's
from Green
okay.
Translation joining us this afternoon?
Laura, do you know if anybody
Okay.
was added for interpretation?
Dave,
Go ahead, Mike.
oh, go ahead. Oh, no, go ahead.
Earlier, I thought someone spoke up saying they were from it, so I added them, but that might have been a misunderstanding.
I think she needed.
I
the
believe it was. I
interpretation.
think I see Maria that she está bien, entiendo un poco de inglés. Okay.
Okay.
Okay, then yeah, let me see. Let me contact Green Translation, see if they can get us somebody. I know we're almost done with our conversation today, but so we apologize for that on our end. I think I picked up that Maria was our interpreter. I apologize for that.
I did too, Mike. I'm so sorry, everybody.
Yeah, well, you guys were not the only ones.
Okay. Thank you.
So, like, I thought there was an interpreter too, because she spoke up about it, and then I think she went MIA.
That is okay. We'll get it figured out. Thank you, everybody. I'm so sorry about that. Okay. Well, while Mike gets a hold of the translation services, I'm going to go ahead and keep going. And then we can figure out translation from there.
Maybe you can send it out to that person in Spanish so that they can be able to at least read it.
Yeah, we'll send out everything in follow-up in English and Spanish. And that way, if folks want to join the conversation after and they have feedback for what I talked about earlier, they're more than welcome to do it via email or on the forum as well.
I think that would be a good solution.
Yeah, so too. All right, so we'll go ahead and keep on going. I was just going to show you all just quickly, if you'd like to sign up for the forum, you're more than welcome to do so. And let me log out here so it looks like what it normally looks like. So what you do is up at the top right of sign up, and then this already has all my info in it, but you can just follow the directions. You put your username. I just have my email as my username and email address, which is the same. Make a password, and then press I agree, and you can look at the terms and rules here and create the account. And then from there, thank you, Lindsay. From there, you can head into the forums. You can, like I said, click on these individual conversations and add to the conversations by scrolling down and commenting. And you can comment by typing. You can also add pictures and attachments. And then if you would like, if you have questions or comments or celebrations, like here we're celebrating Carlos, or anything you'd like to bring to our LAC DHS hub community, you're more than welcome to by clicking new topic. You just have to make sure you have a title and then something for the body. So your comments, questions, celebrations, wins, anything that you want to share here in the box, and then you press post, and then it'll post. And then again, people can interact by commenting on the individual posts. So that's how you join. And when you do join, it does say that I do need to approve. So it when you sign up, it may not go straight to the forums. I do have to approve it, so it may take a day or two to get that approval. So that is the forums. Like I said, they are new to us, so excuse any construction of the site or anything like that as we get it up and going. Do we have any questions about the forum, the online forum?
Who can all see that?
This, anybody who signs up. So here, let me show you what it looks like when I'm not signed in. So anybody can see it, but not everybody can. If you're not a member, you can't like comment or like or anything like that.
Yeah, that's a good question, Kelly, as to who can see it. So keep things, whatever you would want to share with others in this community,
Yeah.
Can go there.
Yes.
It is open and there is approval processes, like Laura said, but it will be open to anyone within this community who chooses to access it.
Are you guys connected to the hub of what's it called? GCFS?
No.
Not that I'm aware of. No, we are not.
I just asked because I know that like some portals are connected that way, like governmental portals.
Oh, I see. Yeah, so if the DHS, so I think you're maybe more talking about the portals, if the DHS portal connects with the other one.
Yeah, I was just kind of like curious to okay, so there's so many different portals.
Yeah.
And I know that there's a hub, DCFS hub, and they have their own portal.
Oh.
And then there's you guys, and then I know there's Next MD. There's just so many different portals.
So many, yeah.
Are they by any means connected? Because if you guys are talking about providing information and kind of like records in a way, I think it would be beneficial to be able to connect with all these other portals, because then you don't have clients basically repeating themselves constantly and repeating all the work that they're doing with one provider to the next.
Yeah, I just looked it up, and Veronica, you probably have more information, but it does look like the Department of Children and Family Services is part of DHS. Veronica, can you confirm how that overlaps maybe?
Yeah, so it's part of DHS, but the portals are separated. So the LA Health portal in particular is just for our, so let's say you come in for a primary care appointment or any specialty appointment at your location. So that's the kind of information that you would see there. You would also see urgent care, emergency, all of that. But as far as so this is a great question, and I really love that you brought this up, because I recently had a meeting with the Department of Mental Health, and they talked to me about their portal in particular. And they're part of DHS, but we so what I did was I went back to Cerner, who is the the host of our portal, the LA Health portal. And I
Yeah.
talked to them and I was like, hey, so I did talk to the Department of Mental Health. We talked about portals. They're completely separate. I want to know a little bit why. But the reason why is because it's pulling the information from different areas. So currently there's no current set plan that would feasibly merge all of this information into one portal. That is the ultimate goal within DHS. Like that's what we're striving for. But currently, the way that the health system and the electronic health records are set up, it makes it a little bit difficult. So first, we need to work on the back end of things, and then we can work towards merging everything together. I definitely agree with you. I think that it would be much easier for our patients to see everything in one portal. So
Well, it's not just your patients, but if you look at the communication basis between one doctor and one professional to the other, it breaks down that system. Our health system sucks, point blank, because there's no communication between one provider to the next. And then you've got sometimes prescription issues, you've got mental health issues, you've got the whole system, and it's no communication basis basically between them.
yeah.
And how do you better care for a patient? Like for me, for instance, I have a primary care physician. I also have a psychiatrist and a therapist.
Sí, en ese
And-
de ahí no dice que la clínica, algo dice la nota ahí.
And all these places are not all connected. And so it makes it harder to get the best care possible if nobody's really communicating with each other.
Yeah, no, I 100% agree with you. I think that the way that we've tried to mitigate this, or the way that we've tried to target this and aid this, is by making sure that patients do have access to all their medical health records. So like, let's say you're going to a therapist and the therapist is like, oh, what's your prescription list like? And you don't know, right? But if you have your portal active, you can pull it up, and then you'll pull up the document with all of that. So that's kind of like the way that we're trying to prevent issues like this from happening.
But how do you do that with HIPAA involved? Because then you got violations going on. But if you were all connected to one portal, everybody would be able to see what's going on so they can better assist that patient and that patient's family, like the young kids that belong to that mom or dad, to be able to better assist that family and what they need.
Yeah, no,
without breaking HIPAA violations, because there'd be one consent form and everybody would be able to communicate with each other in order to provide the best care possible.
So the feedback that I've gotten and what I've heard is that another reason why it's hard to merge everything together is because of the HIPAA laws, because we need to know, there has to be a lot of consent forms that would be signed in order for this to happen completely. And it's, I think that the hardest part right now is just our electronic health record system, the way that it's not merged together. So that's what we're I think we should target and what we're targeting at the moment in order to make sure that this is something that's feasible that we can bring to our patients in the future. But definitely great feedback.
I could definitely respect that. Like, I hope it all merges to be one, because then there's not so many controversial voices, basically, and there's not so much hassle on the patient's end on getting the right care.
Yeah. Yeah, no, you're completely right.
There's always more to improve.
Oh,
Yeah.
absolutely.
Definitely.
Medical field's definitely one of those that's always evolving.
Yes.
Thank you, Kelly. The great insight that we will take over to our team and continue to explore. I wanted to see, checking with Graciela Jordan. Did you have a comment that you wanted to share? Tenía un comentario que quería darles a todos.
Hi. No, I listen. I going to checking later. Maybe you send all the record because I enter late.
Está bien. Muchas gracias.
De nada.
Thank you. And thank you, Veronica, and everyone for these great discussions. I do want to say real quick that this forum here is for patients and families of our hub to connect with one another. So it's more of a community building kind of thing. Think like a Facebook group or something like that to connect with one another. So thank you, everybody, and we look forward to connecting on our new forum. We do want you to save the date, May 1st, for our patient community open house at the California Endowment Center. We are still in the planning of this, so this is merely just to save the date. We want you to come on over and meet face-to-face in person, and there's going to be a lot of things to learn about the communities, and we're excited to just connect with one another.
Are you bringing the snacks?
Oh,
Yeah.
I believe so.
Food will be provided.
I have to know if I'm going to save a date.
That's a really good point.
Are
Food will be
snacks
provided.
involved?
Yep, and we will. It'll be
And
a
are
great.
we meeting in an open house so I know, like, I get this house too?
Oh, no houses.
No houses.
I'm joking.
But we'll have a lot of, a lot to learn, a ton of LA based patients, parents, families there as well as folks from around the country who are patient family advisors or serve in that role. So you can, learn more about how they got more involved with their role and really where it can take you when you partner with healthcare in this way. So I'm looking forward to it. We're going to have some fun. We'll definitely eat some food and just look forward to meeting people.
Yeah.
Well, absolutely.
Yeah.
It
So-
helps being able to meet others and be able to really dive into getting better healthcare and better services, not just for
Absolutely.
yourself, but like
For
our
everyone.
kids and others, and how do we better reach the rest of the community so that way the health crises that we are facing, like mental health crises, are not going on, because there are 3 to 6 month wait lists for mental health services.
Yeah.
And there's just such a gap
Yep.
in what needs to happen. And even with providers, there's such a gap on them doing their role. Like, I had a provider that I was seeing when I was pregnant throughout my whole pregnancy with my younger daughter. And then I went to go see the provider right after I had her, and they had bounced.
Mm.
Yeah.
Kind of went MIA, and I was like, what the?
Yeah.
And then from there, I went and saw a different provider, but that was a 3 to 6 month wait list in itself. And the communication between that provider in itself sucked. And they were never like able to fill my prescriptions, which put me back even more to waiting another 5 months after trying to work with the person for 5 more months. It was just, it was horrible.
Yeah.
So there's just such a gap, and mental health needs to be addressed better too.
Yeah, absolutely. I think you're right on point, Kelly, and that's, you know, what we're all here for, is to have these conversations and really use our own stories and experiences to help, you know, bring light to some of the change and improvements that are needed in healthcare. So you're in the right place.
Yeah, absolutely.
Yay me.
So yes, keep an eye out for more information on this open house as we get to planning, and we look forward to seeing you all in person.
Oh, absolutely. I look forward to meeting all of you and seeing how we can better be a voice to help get the needs met across the board.
Absolutely. All right, I'll go ahead and Lindsay, do you want to share screen real quick?
Yeah, just really quickly, one more opportunity that we wanted to share. And I will also see if we can get interpretation for this as well. But we are hosting our organization, PFCC Partners. We also host a larger patient family advisor network that's nationwide. And we do what we call skills exchanges once a quarter, all throughout the year. So this skills exchange coming up, it's called the Core Competencies of Effective Partners. It's a 2-part skills exchange starting on Monday, February 6th, and then ends Monday, February 13th. Both of the sessions are from 10 to 11:30. And we go through the core competencies of effective partners and do some activities and just learn learn what the skills are that are needed to be a really effective partner in our own healthcare, and when we are in conversations like this and talking with healthcare staff about, you know, the changes that we want to see in healthcare, and using our experiences to help influence some of that improvement. So the 5 core competencies are in the triangle that you can see there, and we will dive deep into each one of them. But it's a great learning opportunity, another great chance to meet other patient family advisors in this work, and we just wanted to invite all of you as well. I will put the registration in the chat for everyone, but hope that you can see us there. And if you are joining us from the LA Care child development classes, Naomi, who was the teacher in that class, will be the teacher in this class as well, and facilitating these 2 sessions. So I just wanted to quickly touch on that. We'll share more information in follow-up, but I will go ahead and put the registration link in the chat if you would like to join and learn more.
Wait, what childhood development class? Which one? The one on the 5th of January?
Yes, yeah, with Naomi. Yeah, she will be facilitating these 2.
Oh, sweet.
Yeah,
Even better.
exactly. She's great.
We love Naomi. All
I
right.
just love learning, so.
Yep.
Yes. All right. And then we also have a reporter from LA Times came to us at PFCC Partners, and they're looking there. She's covering public health issues, and she's looking for someone with lived experience with hospital-acquired sepsis in California during the pandemic to interview. She just wants to learn about your experiences. So if you've had that experience sometime between March of 2020 and the present, my email is there on the screen. Feel free to email me if you're interested, and we'll get you connected to Emily. And that's going to wrap it up for our meeting today. Thank you everyone for joining us. Our next meeting is February 27th, same time, same Zoom link, and we will see you there. And we'll see you on the forums in between. Thank you, everybody.
Thanks, everyone.
Thank you.